Well, good evening. Dr. Dan Graham coming at you once again from downtown Gilbert Healthcare, and I am joined with our resident expert on health, Dr. Alan Bradford.
Hello, hello.
Dr. Bradford, we're going to be
Yes.
talking today about a nasty term, addiction.
Yeah, man, addiction, it's out there, and this whole pandemic, I think, made it even worse.
Oh, it made everything worse.
Everything worse, including, people hitting the bottle more, people using their cigarettes more, it's when we're stressed out, when we're isolated, when we feel hopeless, and when we feel like we have no control over the situation, then we're going to resort to something that we can control,
Kind of numb it up.
and we're going to escape. And I think
Right.
a lot of people have been doing that. So,
This is an interesting experiment that we're going under, and interesting that the rules have been relaxed a little bit to where people can get this sort of thing, the different pain meds and muscle relaxers,
Mhm.
quite a bit easier than, waiting in line for the doctor's office now.
yeah. Yeah.
Even with certain medications being called in, and so when it comes to addiction, what's fascinating, here at downtown Gilbert Healthcare, we run a Suboxone clinic, but Dr. Bradford also combines acupuncture with that treatment. And what's fascinating with me is the first time that I saw you do acupuncture treatment was for smoking cessation.
Right.
And what was interesting is we're talking about a pack and a half a day on this patient,
Mhm.
and she went down to 4 cigarettes a day in the first week.
Yeah.
So that's pack and a half a day down to, what is it, 20 cigarettes in a
30,
pack, I think?
30 cigarettes, yeah, 20 in a pack, so she
Yeah.
was smoking 30 at least a day, and down to about 4.
Isn't that fascinating?
Yeah.
And what's interesting is when I talked to her and I said, what do you feel? And she goes, now it's more of just the habit. She goes, I just have always been used to having something. She goes, the cravings are just gone.
Yeah.
And so that is fascinating. So, Doc, once you get into that, you're sticking needles in people's ears. How in the hell is that making a difference
Needles.
on the addiction?
We know how Dr. Dan feels about needles now. So ear needles. So these, they're super tiny. Look at, you can't even hardly
Yeah.
see them.
That's fascinating.
5 needles each ear. This is something called the NADA protocol. NADA stands for National Acupuncture Detoxification Association. I've been certified through them, went through some additional training with them to learn this protocol and learn when to use it. And so we use it with addiction. We use it with any manner of addiction, whether that's hard drugs, methamphetamines, heroin, or something like alcohol or tobacco. 5 needles each ear. Treatment lasts about a half an hour. Come in for at least 10 treatments is what's recommended initially, and then after that, as needed. But what we see is decrease in cravings, decrease in irritability and anxiety that comes along with quitting an addictive substance.
Immediate.
Yeah, within the first treatment or so. People are more even-keeled, not angry, not aggressive. You cut out something like that out of your life, and it's life-changing. And so we want to balance out the mind, balance out the physical side of the cravings and addictions, and with acupuncture we can do that.
So does the acupuncture hit more of does it affect the mind or the energy, or how's it?
So there's 5 needles that go in each ear. The first one goes into a point called Shen Men, and this helps calm the mind. The second point goes into an area in the ear called the autonomic point, autonomic nervous system, your fight or flight response.
Okay.
And then the remaining 3 are in the kidney, the liver, and the lung. These are your major organs of detox.
Sure.
Through having bowel movements and urinating and breathing stuff out and all that, sweating. And so it's treating the physical side of addiction. It's also treating the mental, emotional side of addiction.
That is fascinating.
Yeah.
Well, one thing I've noticed is that when we talk to the patients that are addicted to heroin or smoking, no one wants to be on another medication, whether it's Chantix or Suboxone. Very few people are just looking for, I just want to replace one narcotic with another narcotic,
Yeah.
and then just go along the merry way. It costs money, and it can give issues. You can get DUIs off of this stuff. just having a doctor's prescription does not give you the right to go out and drive on it.
Yeah.
And so there are dangers behind it. And what I find is that, you know, even the younger adults that are coming in, they do not want to be on this. They see how it's taking a toll on their life, taking up too much time, too much money. There's dangers to it. And Doc, I'm very, very happy to have talked about this treatment protocol that you've offered, because it's really changing people's lives and saving their life as well.
So I'll go back to on my personal Instagram, if you're following me there, Dr. Alan Bradford. I've been talking about this concept of the therapeutic order. And so this is kind of what guides the thinking of a naturopathic doctor. How do we approach a patient? The second step up on that therapeutic order is stimulating your body's ability to heal. And so using treatments like acupuncture, we're going to tap into that, and we're going to give your body a little prompt, a little nudge to start to heal, and then get out of the way. And so we're not replacing one drug for another. We're tapping into your body's ability to heal. We know that you can do that.
Good. All right, Downtown Gilbert Healthcare. Give us a call if you know of someone who is suffering with some addictive issues. Then hopefully Dr. Bradford can give them a hand.
Yeah.
All right.